Hi, everyone. For those of you who don't know me, my name is Lorena, and I'm the founder of Infinita Wellness. In my last video, I discussed the basics of what the thyroid is, where it's located, and some of the functions within your body that it's responsible for. But today I want to go into a little bit more depth on two thyroid diseases, one known as hypothyroidism and the other known as hyperthyroidism. And I'll also go over what testing physicians will likely run to assess your thyroid and what the lab testing means. And I'm also joined again by my beautiful special guest, Miss Ruby, who's taking a little nap on my lap. So let's get into it. So what is hypothyroidism? Hypothyroidism occurs when your thyroid gland fails to produce enough thyroid hormones, primarily T4 and T3. And this deficiency can slow down bodily functions because, as I had mentioned in my last video, your thyroid is responsible for your metabolism or your BMR. So think about what would happen when your metabolism is slow. Things like constipation, fatigue, weight gain, cold intolerance, dry skin, hair loss, depression. Okay. So some of the tests that are typically run to diagnose hypothyroidism are TSH and then some other free thyroid hormones. So let's start with the main one, which is your TSH, also known as your thyroid stimulating hormone. So this is a very common test that most physicians will run. So what the TSH is it's produced by your pituitary gland in response to low levels of thyroid hormones, particularly in hypothyroidism. So in hypothyroidism, your pituitary gland is actually going to release more TSH to stimulate your thyroid gland, resulting in elevated TSH levels. So your body is really smart and it always tries to get into balance or homeostasis. So if your thyroid gland is failing to produce enough thyroid hormones, it's sending a signal up to your pituitary saying, we don't have enough thyroid hormone. You need to send us more signaling. And so that's why that TSH will go up. So a lot of people are typically confused by this because they'll say, I have high thyroid, or they don't really understand what that means. So think it's kind of like the opposite. So in hypothyroidism, your body is not producing enough thyroid hormone. So your thyroid is sending a signal up to your pituitary saying, we don't have enough thyroid hormone, send us more signaling, and that TSH goes up. So hypothyroidism, elevated TSH. Okay. So that's a very basic test. Now, some other testing that I think is important is looking at the free thyroid hormones. So what the free thyroid hormones are they're the unbound hormones that are available in the body for use. Because if they're bound, they're really not that useful. So I think looking at the free markers is what's more prudent. So your free T4 is your T4 in general is the main hormone that's produced by your thyroid gland. So in hypothyroidism, T4 levels are usually low because of decreased production in that thyroid gland. Okay, so you can ask your physician to run a free T4 test, and that will generally be low in hypothyroidism. Now, your free T3, a lot of it is actually converted from T4 in the peripheral tissues, and there are certain factors that are necessary for that conversion to happen. But there is a small amount that's directly secreted by your thyroid gland. So I think it's important to also look at your free T3 levels, and there's optimal levels and ratios between your free T4 and free T3, which I'll get into in another more detailed video. But today I really just want to keep it simple. So another test you want to ask your physician for is a free T3 level. Okay. And then lastly, it's important to look at your thyroid antibodies because even if your thyroid levels, your TSH, your free thyroid hormones look normal, you might still have an autoimmune response to your thyroid. So in autoimmune thyroid disease, your immune system is attacking your thyroid. And sometimes that happens and it's not, your thyroid levels will still be normal. So that's why you still want to look at your autoimmune thyroid markers. And one of the most common causes of hypothyroidism is Hashimoto's, which is an autoimmune thyroid disease. So the two tests that you can ask your physician to run are thyroid peroxidase antibodies, better known as TPO, and your thyroglobulin antibodies. And these will help diagnose autoimmune thyroid disorders. If those markers are elevated, but your thyroid levels are normal, ask your physician what they would recommend, because you don't want to just not do anything because there's something going on within your immune system. Okay. And you also want to ask them to give you an order for a thyroid ultrasound, because it is common in autoimmune thyroid disease for the thyroid gland to possibly be enlarged or have nodularities. So you want to make sure that you're having someone take a look at the anatomy of your thyroid gland. I also want to mention, so that's really hypothyroidism in a nutshell, but there is something known as subclinical hypothyroidism. And I think this is really important to mention because there are a lot of people who are suffering with a lot of the symptoms that I mentioned, but when their doctors just run a basic TSH test, their TSH looks normal, and their doctor's like, oh, well, it's not your thyroid, but they could still be suffering from a thyroid issue. So like I mentioned, you want to make sure that your doctor is looking at your free thyroid hormones, because that can be telling a story. And you want to make sure that those levels are optimal. So in my next video, I'll talk about what optimal levels really look like, because I think that's really important. And you also want your doctor to look at some of those factors that I mentioned that are important in converting to your active T3, because if you're lacking any of those nutrients, which in our societies, a lot of people are suffering from nutrient deficiencies. So you want to make sure that your doctor is looking at those, because if those are not optimized, by repleting those nutrients, you might start to notice that you're actually feeling better. Okay, so let's get into hyperthyroidism. Hyperthyroidism is the exact opposite of hypothyroidism. So it's when your thyroid gland is producing an excessive amount of thyroid hormone. And this overactivity accelerates bodily functions because your metabolism is on overdrive. So this will lead to symptoms such as weight loss, rapid heartbeat, nervousness or anxiety, heat intolerance, sweating, tremors. And so I do want to say that these are textbook symptoms of each disease, and sometimes a patient's symptoms don't match the disease, but these are the most common ones. So I think they're important to mention. So when you're diagnosing hyperthyroidism, the first test your doctor will look at is your TSH. And in hyperthyroidism, the thyroid gland is producing an excessive amount of thyroid hormone. So what is it doing? Your thyroid, very smart, is sending a signal up to your pituitary saying, we have way too much thyroid hormone. Don't send us any more signaling. We have too much. So what's going to happen is that TSH is actually going to go down. So in hyperthyroidism, you'll see patients with low TSH, okay? And that's that negative feedback loop that I was mentioning. So as you may already assume, your free T4 and free T3 levels will be elevated, confirming that you have hyperthyroidism. And when it comes to antibodies, you want your doctor to run the ones that I mentioned before, your TPO and your thyroglobulin antibody. But one of the most common causes of hyperthyroidism is an autoimmune thyroid disease known as Graves'. And a marker for that is known as TSI, or thyroid stimulating immunoglobulin. So you want your doctor to run that too. And it's a simple blood test that you can do through LabCorp or Quest. Now, if your TSI levels are elevated, your physician should absolutely give you an order for a thyroid ultrasound, because an enlarged thyroid is very common in Graves' disease. And your physician, depending on how long the disease has progressed, they may also send you to an ophthalmologist, because it can be common for Graves' or hyperthyroidism to affect the eyes. Okay, so that's really hypo and hyperthyroidism. So just to summarize, in both, as you can see, TSH plays a really vital role in regulating thyroid function. In hypothyroidism, the pituitary gland releases more TSH to stimulate the underactive thyroid gland, resulting in elevated TSH levels. And conversely, in hyperthyroidism, excessive thyroid hormones suppress TSH production, leading to decreased TSH levels. And this is that negative feedback loop that will hopefully help maintain your thyroid hormone levels within a normal range under normal conditions. So if you're experiencing any symptoms of thyroid dysfunction, contact your licensed healthcare provider, tell them what your symptoms are, tell them about the testing that you want to do, and be your best health advocate at the end of the day. So I hope this video helped clear up any confusion you may have had on the thyroid and the different thyroid diseases that are prevalent. And if you have any questions, please feel free to reach out to me. You can go on my website, www.infinitowellness.com, or you can leave your comments below and I'll be happy to answer them. Okay, have a blessed day.